So hello all, today we are going to review this Coltene Speedex Putty, and we'll see, we'll mix it, we'll try it in pressure and we'll see. So as you can see, this is the universal activator by Speedex Coltene, and this is the light body tube that comes along with the C silicone, that is putty of Coltene. And we will now try to take impression on a jaw set, and we have to take one scoop of this C silicone, that is condensation silicone putty, and we have to mix it well, we have to knead it to make this dough softer, and then we have to put this activator on this putty. By putting this activator we have to mix it, and only then it will get hardened. The putty that is soft in consistency right now, when it comes in contact with the activator it gets hardened, and every company has its own setting temperature, and that you have to read it on the box itself, that how much time this takes to get hardened or get set. Now we have to make a roll of it, and we have to load it on the tray. This is called as loading tray. Loading the impression material on the impression tray, and then we have to take the impression in patient's mouth. Here we are doing it on a jaw set in a maxillary arch. We have to put this impression in patient's mouth, and we have to press it gently so that it covers all the teeth and it gets well settled in patient's mouth. And for this, the setting time has been written as 2 to 2.5 minutes. That means after 2.5 minutes it will get hardened or it will get set. So you should read before or taking this impression of every company, so that you get to know that how much time you have to keep it in patient's mouth. So now after 2.5 minutes we'll try to remove this impression tray from patient's mouth, and you can see I'm trying my best, and it's been set and it has come out quite well. This is the first impression. We are taking this double impression technique, and then we'll take the second impression of this light body. You have to take a glass slab. Some companies give this mixing pad also with this putty impression material. So now I have to put this light body on the glass slab, and along with this we'll put the activator and we will mix it well. Right now it is in a flowable consistency, and you can see this is the universal activator that comes with the Coltene Speedex Putty. And now we will mix it up with the cement spatula, and you have to mix it quite well. You can see both colors are different, so you have to see that it gets mixed well. And then you have to take this light body and you have to put it in that impression that we have taken, the first impression, and the area which is required you have to put it on that also, and other areas also, the other teeth also, you have to put the impression in that. The impression actually comes quite well. And after placing it, you have to again place it in patient's mouth in the same way, in the same manner that you have done in the first impression, and just press it well. It will not take that much of pressure now, and you have to take the excess out. And there is a one tip that I'm going to give it to you. The excess material that you see on spatula, you can put it on your glove, so that you come to know when it's get hardened, and its setting temperature. When it gets set, it will give you a stretchy or a rubbery feel. You will see when you have mixed it, it was in a flowable consistency, the sticky consistency, but when it gets set up or when it gets hardened, it will be in a rubbery consistency. You can take it in your hand and you can stretch it like a rubber band or like a rubber consistency. So I'm continuously checking that the left part on my gloves. See, this is it's getting stretched, so but not properly, so we have to wait again for some time for this to get hardened or to be in a stretchy or a rubbery consistency. See, here I can see it has been set and it's in a rubbery consistency now, and I'll try to remove this impression tray from patient's mouth here in the jaw set, and you can see I'm trying my best and it has come quite well. You can see the color combination also, it's very good. And actually I have used many silicones and silicone impression material, but this Coltene I liked it very much because it gives you a good margins, it gives you a good impression actually. Yeah, and this is good. Thank you. Now I'll show you the impression. You can see the margins, how good it has come. Overall it is a very satisfactory material to be used in your dental clinics. Please subscribe. Thank you.